Welcome to Unscripted Let's Talk, episode 16. This is Mary Eggleston, and I am here today with Dr. Carol Nelson, who is a neurologist at Avera. And it's pretty exciting that she's here. We're here to talk about trauma in the brain, and who better than a neurologist to talk with about the development of the brain itself. So thank you for being here, Dr. Nelson, whom I'm now going to call Carol.
Perfect. I'm happy to be here.
Yeah. So tell me a little bit about your background, how you decided to become a neurologist, because I think who decides to become a neurologist? That's got to be, that's a lot of time, a lot of study. Wow.
So I knew I wanted to be a doctor when I was, actually my very youngest memories, I knew I wanted to be a doctor. And then when I got to be in high school, I started working as a nurse's aide, and I really enjoyed that, and I really liked the sciences in school. And then I kind of stepped back and I thought, gosh, do I just want to be a doctor because that's what my dad does? And so my mom was a stay-at-home mom, my dad was a doctor, and I didn't really know. I mean, people know what teachers do and nurses do, and otherwise you know kind of what your parents do. And so I actually stepped back and tried to think, do I really like this? But I did. I liked to go with my dad. This is the days way before HIPAA. And I would go with my dad and to stitch somebody up or to reset a broken limb, and he'd let me watch and experience it. And then as I was a nurse's aide, I was, of course, able to do that, and I was able to go into deliveries because I was working. So I would watch babies be born. I would watch some surgeries, and I was always just fascinated by the complexity of medicine and science and the human body. So when I graduated from high school, and all through high school, my job was always to babysit. And so we weren't allowed to date till we were 16. And so I was like the oldest one able to take care of the youngest people that needed a baby, the youngest babies. Mm-hmm. And I just loved taking care of kids. So I always thought I wanted to be a pediatrician. So actually, when I go back to my hometown now, people still think I'm a pediatrician. Like,
are you still because everybody thought that's what you were going to do.
Right. I never was, but I am still a neurologist. But then I went to college and enjoyed the sciences still, went to medical school, and I got into my junior year of medical school, which is when you do the clinical stuff, and I did pediatrics, and I didn't love it. I like the kids, but the kids are in distress, and the parents are in distress, and the kids can't really tell you what they want or need or feel. And I thought, oh no, what am I going to do? Because that's what I always thought I wanted to do. So I thought about what classes I liked in medical school, and my very favorite class was neuroanatomy, and I really liked that teacher, Dr. Josie Moore, who has passed away since then. She was a really organized teacher, really good, made it really an exciting class. It was very interactive. She was an artist, and she would draw the brain, the different cuts of the brain and whatever, and we would get these blank pieces of paper with just an outline, and then she had us all have colored pencils, and we would draw with her as we were going through the different functions of the brain.
That is a brilliant way to learn. Mm-hmm. That's absolutely brilliant, because it's coming in, the information is coming in more than one way.
Right.
Oh.
And I still always say, stuff goes into my brain so much better if it goes through my pencil.
Yeah.
I've got to write.
Well, to hear something, to see something, mm-hmm. and then to have a kinesthetic experience of it.
Feel it.
That's that's really powerful.
Mm-hmm. And she was just really, really a good teacher. And so I really loved neuroanatomy. And then as I got a little further in school, people would ask me if they had a neuro question in the class or in our small groups. Mm-hmm. And they're like, well, Carol will know that it's neuro. And then I started thinking about what I wanted to do. And I thought, well, it's neurology. Neurology is what I'm drawn to. It's very organized. Like everybody's mm-hmm. pathways go the same way. Mm-hmm. And you can listen to a problem, do the physical exam, and what a neurologist is doing that whole time is trying to figure out where the lesion, it's lesion localization based upon the history and the physical exam. Once I know where the lesion is and I listen to how it develops and what's going on, I can tell, is it MS, or get fairly close. Is it a tumor? Is it a bleed? Is it psychosomatic? And that just, the organization and the consistency of it just is what I did the best with. So then I decided neurology is probably a good fit for
Plus, the other students were already giving you the information that you were a natural neurologist. Interesting how we
Right.
get information like that from people.
And it's interesting how that doesn't come to your full consciousness until you sit back and think about it. I'm like, oh gosh, of course that's what I need.
They knew before I did.
Yeah, right. Mm-hmm.
Wow. Okay. Oh, I'm glad I asked that question. That was really fun to hear. So often in my practice, clients will come to me and they'll have had childhood abuse, neglect, trauma, and they blame themselves for it. They think that somehow they should have known, that their parents didn't realize, or any number of adult type thoughts. And I'll say to them, you were a child. Your brain was not fully developed. And so people think that when they're born, their brain is fully developed. And I in my not as elaborate way as you would, I explain to them that that's not the case. So how does the brain develop, Carol?
So the brain develops, just like our whole body, just from a very few cells that gradually grows and each area becomes more specialized to do its particular job. Just like, we know about stem cells, and there's a lot of research with stem cells. So you start out with stem cells, and the stem cell can become anything, depending upon what it's located by. So the brain starts to develop, and we're going to talk about the amygdala later, so I'll talk about that. So what's by that area is going to develop the job of the amygdala, and the part that's going to be the hippocampus, which is by it, develops that specific functioning. So your brain gradually grows and develops, and as we get older, like in toddler age, as they get older, the brain myelinates more. So the myelin is the area around the nerve cell that's basically the insulation. Like if you think of each nerve as a wire, because the brain is electric, if you put the insulation around it, the impulse or the message goes faster, and it doesn't peter out as it goes, like a wire would if you didn't have it insulated. So as you get older, your brain becomes more and more myelinated, which is why a 3-month-old can't be potty trained, and
Right.
a 6-month-old can't be potty trained. But once they're old enough to walk and think, their brain is more myelinated, and they have the ability to control their bladder. But before that point, they don't, because the nerves are not all myelinated to their bladder, and they're not fully developed in their frontal lobes to know, oh, that sensation means I have to go to the bathroom, and let me walk to the bathroom because now I can walk and control my bladder until I get there. So your brain develops over time, and then it myelinates over time. And there are studies, I don't remember the exact number of this, but a female teenager's brain develops faster than a male teenager's brain.
Well, of course.
Right. And so a female teenager will look, like let's say they're up on some high place. They're going to look down and think, oh, I probably shouldn't do that because I might break my leg. Whereas a male will stand up there and think, oh, I think I can do it. And then his friends egg him on, and that's enough for them.
And then
They
they
go to
jump.
jump. And then they break their leg, and instead of thinking, oh, that was a bad idea, they think, oh, that was bad luck.
Yeah, it's just bad.
And actually that particular analogy comes from James Dobson that I read, because I have 3 boys myself, and I'm like, what is going on? So I read the development of boys, raising boys, I think is the name. But there's a study that shows that the male teenage and young 20 brain is less than a millisecond slower than the females. But it's that millisecond that they don't have time to think through what they need to think through before they make a decision, and so that's why they jump. And the female brain is just a little bit faster, not very much, but a little bit faster at that age.
At that age.
Right, and then they
Which is
catch
why
up.
you see all the risk taking
Right.
among teenage boys and young men.
Right,
Oh, that's that explains so much.
right, and then it catches up.
Yeah.
but it's just a little bit slower. Yeah.
And I have read studies that say that society, we need teenage thinking and young men thinking and young women who take these risks because it shakes up what otherwise we would just entrench in terms of how we handle things. So we need some of it, but we also, of course, want to keep them alive. And so we're always talking to our sons, please listen to me. Please don't jump.
And you love the wildness of their ideas.
Yes.
And we can all learn from that. But I was
always
like
reeling it in.
Reining it in and make sure they're staying safe and think, now you realize you're responsible for your friends when you go out on that boat in those big waves, right?
Yeah.
Or in the car, you realize
And that
you're
helps
responsible.
because they may not take responsibility for themselves, but they will maybe take responsibility for their friend. Yeah, so that's always a good strategy.
Right.
We'll just throw that one in for free. That's a good strategy. Put them on the hook for their friend. Is if you just try to explain it for them, nah.
That's free advice from parents that have raised boys.
Yes, okay. So the brain of a small child is quite different than the brain of an adult, is what you're saying.
Right.
And a lot of it has to do with the myelin sheaths that you're referring to.
And just the different parts of the brain growing and normally growing
And
normally
diversifying.
developing
So you have 100 cells each in the brain. Each of them could learn a language. But if the only language that all 100 cells learn is English, that's the only language you're going to know.
Exactly.
But
They
if you
learn
put them
what's
in
around them.
Right.
Right.
But if you put them in the Spanish immersion program, they're going to also learn Spanish, and they're going to be able to speak it without an accent.
Right.
And that's the brilliance of doing that with that younger mind.
Right.
Okay.
Like a sponge.
So in a loving and healthy family, the amygdala, the prefrontal cortex, and the anterior cingulate cortex develop as they should. And that's, from what I've read, is called the ACC. And I'm going to let Carol correct me if she wants to. That has to do with the trauma, stress, fight or flight type response. And they provide the needed ways for people to interpret the world, such as what is a threat, what's no big deal, anywhere in between. Tell us about the ACC and its function in the brain.
So the amygdala is an area of the brain, it's in your temporal lobe, so kind of right near, like right above where your ear is, if you're thinking about right where it is, in your temple.
Okay.
And so the amygdala is real deep in there, and it's kind of wrapped by the temporal lobe. And the amygdala is for memory, but particularly memories that are highly emotion activated, like fear.
Wow. Okay.
So the amygdala stores those memories, and the amygdala and the limbic system, which is kind of the older part of our brain, kind of developed early. It's a deep part of your brain. That's for the fight or flight. Or the the cortisol type reaction or the adrenaline type of reaction that people have. It's part of the sympathetic nervous system, which is real quick. It's real fast. Like that's why I'm sure that happened because the cavemen that moved quickly, they got out of the way of the threat. The ones that moved slower didn't, and so those lines didn't develop.
Right. The people who were just taking a chill pill,
right?
They died.
Right.
They didn't make it. Right. They didn't make it.
Right. So the limbic system is real fast, and so when something happens, some external stimuli or something happens, and somebody startles you, you get a really rapid gut reaction. We call it a gut reaction because you feel it in your gut. It's the butterflies.
Oh yeah.
Like I always think of it when even if I'm not speeding, if I see a cop on the highway, I'm like, oh my gosh, I must be speeding. And like, 2 seconds later, you get those butterflies in your stomach. And then what happens is the prefrontal cortex can kick in then. It's a little bit slower. So then your brain by that point can say, oh, no, not a threat. I'm going 65. That's what I'm supposed to be going. It's all fine. So the limbic system is fast. It gets you away from a threat. It makes you run if somebody startles you. And then your prefrontal cortex is what says, nope, it's okay. Let's think through this. You're actually okay. So I'm using it in terms of something really sudden like that. But as we get older, we have other things in our lives that are more complicated than just that kind of stress reaction. So you have your limbic reaction. And then your brain sits back and thinks, you know what, let's think through this. I don't like that. I'm not going to do that anymore. I'm not going to be by that person anymore. And it takes, for myself, I find it takes me 48 hours to work through something.
Yes.
And so the limbic system is real fast and feels really bad, gets you out of the immediate danger. But then your prefrontal cortex can think through it. And that's kind of the humanness of us.
Thank you for saying that it takes 48 hours to think through something. People blame themselves for not having a quicker response, or, I should just get over it.
Right.
Or even other people will say to them, why are you still worried about that? And you're saying, no, it takes 48 hours to get over a perceived threat, to think through it.
Right.
So stress in and of itself doesn't do any damage. Really. There are different levels of stress. There's positive stress, which actually creates kind of a strength and an understanding of life. If we think in terms of a child and the development of the brain and what's all going on in terms of these systems developing. So a child goes in and gets a shot from the doctor, which you and I are both the kinds of mothers where we felt so bad. Hated that because I had to hold them down while they got their shot. It was very stressful.
It feels everything against what you feel a mother should do.
It's just awful.
Yeah.
And yet, we know that the child needs to have the shot, and then afterwards being reassuring to that child that you did really well and it's something you need to do so that later you don't get sick, and you give this explanation, you hold them and nurture them. And that kind of stress simply helps the child interpret the world in a good way.
Right.
We get to the next level of stress, which is more of a tolerable stress, and that could be like the death of a loved one, a natural disaster. And I often tell people that if you go through something like that, and as long as you have someone to talk to and to express what that was like for you, if you have that 48 hours to process it and come through it, you can come through that. And again, that's not going to impact the brain of a child going through that, as long as they have adults who are reassuring and allowing them to have the feelings they have.
And they're growing with that. They're adding those experiences and using them for next time. So the parent is actually helping them to grow, so that when they're on their own, they have some experience, not a shot, or maybe a shot. I hate getting shots. So.
Me too.
But but they know how to deal with it.
Right. They know how to interpret it so that they can walk in and manage the discomfort of it.
Right.
I mean, they're learning how to manage discomfort, and they have a resiliency that begins to develop. But then we have what's called toxic stress, and that's from repeated trauma, and that's a whole other story. Strong, prolonged, frequent abuse, neglect, or violence. What does that do to the brain?
It's curious how much emotional things I feel as a neurologist. It's curious and fascinating and interesting what those outside factors really do to your brain. But they have found that it affects people, and especially children, at the level of where their hormones are made. So it's the hypothalamic pituitary adrenal axis. It's an axis of, your hormones are produced here and they act here, and it actually changes that part of the brain so that it can no longer regulate the release of certain hormones like adrenaline in the correct way. So there's a dysregulation or a loss of regulation where you'll have another response that shouldn't be as large a response, but yet your body responds to it as if it was a large response because it no longer knows how to deal with teeny stressors, especially those repeated kids. It's like everything is a huge stressor, because how does a kid even deal with that? Their brain's not developed, their prefrontal cortex. Well, nobody can do it, really.
No one could.
But at a biochemical level, their brain won't let them do that because it no longer knows what a small stressor is. And that's what leads to like the PTSD.
Right.
The unregulated response to a stimuli.
So someone like this develops what's often called a survivor brain, a survivor part of the brain. And when something in the environment seems like it's similar to some of the abuse they experienced, and this would be an adult who was abused as a child, neglected as a child, it bypasses whatever else that could work it through and goes to the survivor part of the brain. And this part of the brain then begins to fire and say, this is a threat. And so they're having these reactions, these symptoms. Like what are some of the symptoms that you might see?
Well, which is exactly what I'm talking about. What you're talking about, that survivor response, that's your limbic system. And you haven't been able to work it out because your prefrontal cortex hasn't kicked in yet. So what you just said is exactly what I was talking about with the limbic system, which is fast and responsive and reactive. And then your prefrontal cortex has to take the time to figure it out.
And the
But
prefrontal,
it's exactly that.
yeah, and the
it's not
prefrontal
developed.
cortex isn't developed.
Right.
And then later, the person is stuck there. When they're an adult, it's like they're stuck there.
Right. And they have the reactions to stress, which is sweating and rapid heart rate. And if you think about that when it's happening, it feels bad to have your heart
awful.
raise. I mean, I've had some medications or some patients that are on a medication that makes their heart naturally slow down. A beta blocker for headache, because I do a lot of headache. But if I stop it, I tell them you're going to go off it slow, but your heart's going to race. And that feels bad because it's going to feel like you're anxious, but it's just you going off the medicine. And I say it that way because people hate that feeling of feeling like something is causing stress, because then you're like, what is it? Oh, it must be because,
Because
I
of
have
this,
coming
because
up.
of that.
Right. And so your heart races, you get sweaty, you might stumble on your words because your brain's, busy doing other things. The limbic system is kicking in, and you just have this strong stress response to it.
And in that moment, when you're saying that to your patient, that's very similar to what I talk about with my clients, that when this happens, I try to teach them to think that, no, here is what's happening.
Right.
It's not that I'm actually reacting to something in the environment. It's because of what I've been through, and to begin to understand why they're having the reaction.
Right.
So when these people have this reaction, then they go, okay, this is uncomfortable, but I do know what it is, and I do know that this is what's supposed to happen.
Right.
And that's really similar to what I teach people in terms of getting past their trauma. I know what this is. I know that I'm having a reaction from another time. Instead of the judgment, which is what I see people do, of I'm stupid, I'm foolish, I'm
anxious.
dumb, yeah, I'm a loser, all these different things that they believe because they're having a reaction that is a legitimate reaction because of what they've been through, just as getting off that medication. Wow. And if you can have that, if you can think differently, that's a massive first step.
And I think with what you're saying too, if you could take out this feeling of what your perception of what societal norms are, that would be helpful too. This is your body's reaction. I tell people a lot, like for example, if somebody has a concussion or something, and or has something happen with their brain, and they want me to tell them exactly how things are going to go, like what exactly the prognosis is, when is it going to be gone, how is it going to go, what am I going to be left with. And I tell people frequently, I can give you my best guess, but every brain gets to this point with a different history. Like, how good were you in school? Were you a good student? What experiences did you bring into it?
Are you from a loving and nurturing
Right.
family where you're going to have natural self-compassion?
Right.
Or
So
are
how
you from something else?
Right. How did your brain develop that way as well? But also, how many head injuries have you had? Did you play football or hockey or something that you're more prone to head injuries? So everybody comes with a full set of experiences, including the psychological experience, to get to that point when this brain injury happens that they're talking to me about. And so I always tell them that your brain is different than everybody else's brain. It's your own set of experiences got us here. And so I'm going to work within that framework, but I don't know your whole story. Right. So here's the prognosis based upon what I can tell you from a scientific standpoint, but I can't I can't add all this other stuff in unless I knew them before,
Right.
if I've seen them for other reason and I kind of know their baseline. But the brain and the body and the mind, the brain and the mind, of course, are same place but very different.
Uh-huh.
They're very complex, and each
Yeah.
person is so individual.
Yeah, and the mind and the brain are interacting all the time.
Right.
And so that, of course, creates the hope that a person can get through either a concussion
Right.
or abuse as a child, is because the mind can continue to interact with the brain.
Right.
Is that correct?
Right. You can learn.
Yeah.
Right.
And prompt your brain. So often in a session with someone, what I struggle to get is access to the actual part of their mind where the trauma resides, the feelings, the experience, because of course, nobody wants to re-experience that.
Right.
And so they've built up other parts of their mind to protect that that trauma, that
Right.
pain. And it's not simple to allow me in on the level that I need to get in order to help them release the pain and allow them the reactions that they weren't allowed to have as a child.
Right.
Before we began the podcast, you and I were talking about, I saw a thing about a thing with polar bears, how they will be looking to tranquilize a polar bear so that they can do tracking or immunization or any number of things. And you'll see the polar bear running and running and running in full fight or flight. And then they hit the polar bear with the tranquilizer dart, and the polar bear drops. So then they do what they need to do. And as you watch the polar bear come up out of having been dropped by the fight or flight, they shake and they have this like big reaction, and you watch their bodies just kind of like, oh, and that is the body, the brain releasing what it needs to release in order to then be okay following a trauma. What would they be? What would the polar bear be releasing?
I would
what?
I would think it's probably adrenaline, but it's curious when you're telling that story because I think of when I had a surgery one time. I woke up and I was shaky like that, and I couldn't stop. Well, I could kind of make myself stop shivering. It was a shiver, and they put more warm blankets on me, but I was not cold. But they were, kind of talking me through it, and I said, "Well, just let me do it. I feel better. Just let me do it." It kind of stops, and then it kind of build up again, and then it'd stop. And I had that same reaction with the birth of each of my children, and I think it's just stressful to watch people.
Right.
Do that. And so I think people want to help you not do it. But each time I didn't know about this.
Right.
And I always wondered why I did that. And I didn't learn that in medical school. But when I had these huge life-changing, even when you're having a baby, you're kind of in that fight or flight.
Right. Well, that's a massive
right.
stressful experience.
Right. And so I just shivered like that. And it was a pretty violent shiver. But if I would shiver for about 15 seconds and then I'm like, okay, now I'm good, and then it kind of build up again.
But then look at the societal response.
Right.
Oh, she's cold. We don't want her to do that. And then that's like the some of the veterans that I've worked with who they come back from combat, and they'd say how they would come back in and their hands would be shaking and they would be really upset. But then I had a veteran tell me that I didn't want to look like a coward. And so I made myself stop. And I think that's the opposite of what he needed to do. He needed to allow himself to shake and to shiver so that these things can be released. Otherwise, it just goes into the brain, deep in, and now we've got a frozen trauma inside the mind that we need to reaccess. So you can imagine in therapy, I'm reaccessing the trauma to the people needing to shiver, shake, cry, yell, scream, curl into a ball on the floor. I mean, it's not the most fun they ever had, but it is the release of the trauma itself. And we keep looking for ways for people to release it in some, I don't know, nice, neat fashion. Or let's give them a drug to cover it up. But really, the studies are clear that the release of trauma involves this. And I think that's incredible that you have a memory of that even after surgery.
Yeah.
And I have memories of that too, where I'd have some kind of response and my body just needed
Right.
to
And it felt
quiver
better.
and shake. Yeah, and then I felt
Yeah.
better.
Uh,
And yet you feel like you should be embarrassed or something.
Right.
And
it makes you feel vulnerable, I think.
yes.
Like you just don't want to look weak, especially when you're having a baby.
Right. You're supposed to be
I gotta
happy,
take
Carol.
this little thing home.
We're not sending that baby home with her.
You're responsible.
Yeah. Yeah. So I think about the child who is mistreated and can't fight back, can't scream out, can't cry, can't do those things. Their feelings are not acceptable. Or they're maybe just in a family where we don't do feelings.
Or
And-
they don't have that love, I would think, that they don't have a safe space to feel that.
Right.
You know, if you feel like you're not in a space where you can cry, why cry?
Yeah.
I mean, it's draining.
Or if you're told, don't cry, boys don't cry, and girls are weak if they do, well, who's going to want to cry? And so there's a lack of acceptance of our natural human responses,
Right.
which then affects the physical brain.
Right.
Which is, see, I think if people can start to understand that,
Yeah.
it will help them to have more compassion towards themselves.
Right. I was thinking, as you're saying that, I'm thinking about if I have something really stressful, like say at work, and it's not something that should make me cry, but a female's brain is also made that's part of your reaction, which makes you feel like you're weak.
Oh, you're told that you are.
Right. I remember seeing a TV show once, and there was a female physician, and she was mad at her chief. And she said, I'm going to cry when I say this because I'm really, really mad. And you're going to ignore the tears because I'm not weak, and you're just going to listen to what I say. And I remember that because whenever I have felt like I was being weak by crying, I thought I'm not. It's the way my brain is. It's because I'm really, really upset, and that's my response. But it doesn't mean I'm weak, and I'm going to use my words to tell you that I'm not weak, and I'm going to keep going.
Right.
Not hide because I'm crying. Not go to the bathroom and hide and go cry the tears
And then
out.
shame myself for doing
Right.
it, which is what makes everything, it's like it corrupts the brain itself.
Yeah.
You know, not allowing ourselves, our natural responses, whether male or female, whatever, you know,
Right.
whatever your circumstances, is what corrupts the development of the brain. And even as an adult, if you have trauma happen and you're not allowed to properly defend yourself, to be able to say what you really need to say, to take the action that you need to take, there's a corruption again in the mind. And then we add to it by thinking, well, I should be over this.
Right.
Well, I shouldn't even have this reaction. Oh, wait, I'm not a good person because
Right.
I'm not saying it's okay and I love you anyway, or whatever other nonsense society lays on you. You need to have the response. Now, you don't want to get stuck in the response either.
Right.
But the response is crucial so that you can get to the next place.
Right. And I think taking out the societal norm, because when I was younger, it was not acceptable. Even when I was in medical school, it's definitely considered weak to go get your mental health taken care of, to go to a therapist or a counselor.
Absolutely.
And I think the younger generation now is better at that. And I hope society keeps doing, we need to encourage people to go to a therapist and not make people think that's a weakness. I mean,
Right.
take care of yourself.
And we do a little bit more than just nod our heads, we therapists.
Right.
Yeah, people think that that's what I do all day. I just feel bad for people and I nod my head. Yeah, no, that's not really, there's a little
Yeah, I
bit
would
more
think-
to it. It's
I would think that-
rerouting your
Right.
mind as it interacts with your brain. And let's get in and see what kind of healing we can do.
Right.
So,
Again, the mind is much more complex.
right.
You don't, the person coming to you, the client, doesn't want to just have a yes man.
No,
They want help, I'm assuming.
yeah, I hope so.
Yeah.
Because that's what they're going to get from me. So, Carol, this was really wonderful. And I suspect that there's going to be more for us to talk about. So I hope that you're open to returning to the podcast at some point.
That went really fast.
It went really fast. It was, yeah. Well, you're kind of easy to talk to.
I have a lot of life experience.
Yeah, a lot of life experience,
Yeah.
and you're really smart, and so it's really, So we're gonna. My last thought would be really in terms of getting to this place of healing with trauma. What you're looking to do is to depersonalize the trauma, so that you know that it wasn't about you. Your being mistreated, abused, neglected was not about you. And of course, people say all the time, I would never think this about any other child. But I do have this thought about me that somehow I deserved it. Or women I work with in long-term abusive relationships will say, well, I think I deserved it, even though I wouldn't think anybody else deserves it. And it's because it's locked into the physical brain. The physical brain, which is just incredible for people to realize. You're having a reaction in your physical brain. You're not just making stuff up or making a mountain out of a molehill or whatever all those phrases are. And so in beginning to know that, you depersonalize it and you can make it about the abuser instead of yourself.
Yeah.
And then to become unafraid of your emotions, the emotions that need to be released in response to big or small trauma. So we come back to always what I say on the podcast, and that's allowing feelings of love and safety into your life. That's what will bring all kinds of healing forward. So your last thoughts, Carol, before we go.
Gosh, it's hard to kind of summarize what I think is important from that, but I think just to come back to this main issue is don't let your impression of what society feels you should be or do or act or feel. Your feelings particularly are your own. And if you think that you need help, don't feel like it's bad to walk into a therapist's office. Think of it as going to the spa. You're taking care of yourself, just like when you go to the gym or just when you go to get a pedicure to de-stress. You're doing it to take care of yourself. Who cares if you see somebody in the waiting room? Just go. It's important.
Yeah, thank you. So remember to live your lives with intention, purpose, and passion. Until next time.